So today we're going to be talking about a couple of factors that are associated with chronic pain, and we're going to start by just talking about chronic pain itself and what it actually is. So when we're talking about chronic pain, we're talking about a pain experience that you have somewhere in your body that has been lasting for longer than 3 months. At that point, we start calling it chronic pain, and we start differentiating that from acute pain. Oftentimes, this is accompanied by a bunch of other different complex factors that we'll talk about in a little bit, but it's important to talk about the many different names that are associated with chronic pain. So some of the most common term is probably just the generally used chronic pain, but there's a bunch of other terms that have been used in recent years, probably going back 30, 40, 50, 60 years since these sorts of discussions were starting to be had by a couple of famous doctors like Dr. Sarno. So some of the common terminologies would be things like mind-body syndrome, or TMS pain, which is different from transcranial magnetic stimulation, just a different kind of pain terminology. We might also talk about things like central sensitization or somatoform disorders, or even from a previous sort of diagnostic perspective, just calling it something like pain disorder. So there's a lot of different terminologies that you may have heard associated with chronic pain, and possibly may have even been diagnosed with, depending on the sort of like time you received these diagnoses, that would all sort of fit under the umbrella of chronic pain. A lot of these different phenomena have slightly different sort of features, specific phenomena that are associated with them, but broadly they seem to have a lot of similarities that we've been discovering more and more about over time. And there really has been a recent explosion in sort of pain research, and a lot of recent explosion in sort of pain treatment as well. There's a lot of exciting new treatments that we'll talk about in a little bit.